Hello students, today we will discuss two more brief topics which are important and they frequently come in exam of mrcP. First of them is hemolytic uremic syndrome. So as you know that it is a syndrome and it occurs in many conditions. Most common cause of this syndrome is E. coli strain O15787, which causes diarrhea in typical hemolytic uremic syndrome, while in atypical cases it may not cause diarrhea. Hallmark of hemolytic uremic syndrome is thrombocytopenia, hemolytic anemia, and renal failure. Other than E. coli, there can be other causes of the hemolytic uremic syndrome, like infections, pneumococcus. It can also occur in pregnancy, and it can also occur with oral contraceptive pills and certain infections. So, usually in the blood, we see fragmented red blood cells, increased LDH level, and platelet count is low. Treatment is supportive. We just give IV fluid. There is no role of antibiotics, but in severe cases, we can give plasma exchange. Then there is also a monoclonal antibody which is called eculizumab. It has been seen that if it is used with plasma exchange, it has better control over the condition. Then after hemolytic uremic syndrome, there is another important topic that comes in exam, that is metabolic acidosis. Now we will discuss first of all normal anion gap metabolic acidosis. Anion gap is it is the difference between cations, that is sodium and plus potassium, with that of anions, that is chloride and bicarb, and normally it is between 10 to 18. So normal anion gap metabolic acidosis, it occurs if there is diarrhea in which there is bicarbonate lost and potassium is also lost, then ureterosigmoidoscopy, any fistulas, and after that renal tubular acidosis is another condition in which there is normal anion gap metabolic acidosis. Then 3A's. 3A's means that ammonium chloride, it can also produce normal anion gap metabolic acidosis, Addison's disease, and acetazolamide. Then after that, high anion gap metabolic acidosis, it occurs in diabetic ketoacidosis, in uremia, and in lactic acidosis, and also in methanol and salicylate poisoning.